Hello, everyone. I am Melanie Mason. I am the senior politics reporter here in California for Politico. We have so much ground to cover, Secretary, so let's just get into it. Thank you so much for being with us here today.
Thank you.
So this is a weird time to run for governor, because between waiting on Kamala Harris to decide what she was going to do, and now with redistricting, the governor's face has felt frozen. So how do you get people to pay attention to your campaign?
Well, if you want to continue to have a democracy and you want to have the state that's leading in that effort to preserve democracy, we better know who the next governor will be. If you want to continue to be the economic engine of the country, but somehow figure out how to make sure the fourth largest economy can share that prosperity with every family in California, then you want to know who's going to be the next governor. So
earlier today, our David Siders was talking to Senator Padilla if he was jumping in the governor's race and asking, and he didn't say no. So what's your reaction to that?
My sense is he's got his eye on the prize, the way we all should have, and that's November 4th, the redistricting initiative, making sure we don't let Trump do a hostile takeover of democracy and make sure California votes count in Washington, D.C. And if that's what's going to happen, I am all with him. We've been partners for a long, long time, friends for ages, and I look forward to serving with him as governor and he as senator.
Let's say he does jump into the race. What do you offer that Senator Padilla does not?
It's not so much what he doesn't offer or any of the other candidates who are in it. It's what I offer that is right for California today. As I like to say to folks, it's not the bark that counts, it's the bite. And you need to know how to bite. I think for the last 3 decades, I've been learning how to bite as a member of Congress for 24 years, as our Attorney General during Trump 1, when we took him on because he was trying to violate the law against our state and our values. And over 120 times, I had to sue the guy to make sure he didn't touch California. And we succeeded in most of those lawsuits. Bite. When we took over at HHS, we were in the midst of the worst pandemic any of us has ever experienced. We were losing thousands of Americans every day. We were trying to give vaccines to everyone in the country. By the time we left, not only had we gotten some 700 million COVID shots into the arms of Americans, never once having to pay for any of those COVID shots. Find out what's going to happen this fall if you get a COVID shot now for free. But at the same time, after nosediving in the number of Americans who were losing their jobs and, of course, their health insurance, and seeing health insurance coverage tanking, by the time we left, we had hit record levels of Americans with health insurance coverage, never reached before. More than 300 million of us had health insurance coverage by the time we left office.
I think you just alluded to this. You have been very critical of your successor in HHS, Robert F. Kennedy Jr. And especially as he's been shrinking the department, he's gone after vaccines. We've seen just now that the current head of the Centers for Disease Control has just been sacked. So there's a lot that I'm sure you don't like about federal healthcare policy right now. But at the same time, RFK Jr. has championed causes like banning artificial dyes in food, or just overhauling our nation's food system. And these are sort of causes that I think used to be really associated with liberals in California. Do you think there's any areas where RFK Jr. is right?
Oh, undoubtedly. I think all of us want to get so many of those chemicals that are in the food that we eat out that are unnecessary. We'd like to get more of the sodium out of the products that we eat. Why is it that if you buy a bag of potato chips in the U.S., and you go to Europe and all of a sudden you buy the same bag, or you think it's the same bag, you find that it has probably about 40 or 50% less sodium in it than the same bag in the US. There are things we can all agree on, but I cannot agree with the current HHS secretary that it's okay to take $1 trillion out of the Medicaid program, which serves most of the folks working or not working who need that help. And when you realize that more than 50% in California of the births in California are covered through Medicaid, what we call Medi-Cal, and that more than 60% of the funding that we use in Medicaid, what we call Medi-Cal, goes to help our seniors and our folks with disabilities in nursing homes, you realize what $1 trillion means when it's no longer going to be there.
Well, that actually cues me up perfectly for my next question, which, look, in some ways, the good news for you as the former health secretary is that healthcare is going to be a major rallying point for Democrats in the coming year, precisely because of this bill that you talked about, these cuts to Medicaid. But the bad news is that these cuts will blow a hole in the state budget. So if you're governor, let's cut to the chase. Would you support a tax increase to offset those losses?
Let's cut right to the chase. First, I will be California's healthcare governor. Healthcare will be on the 2026 ballot. And there is no way that we are going to go backwards when it comes to healthcare, because healthcare is not a commodity. If you've got a child who is in need of a doctor or perhaps a hospital, you don't say, I'm going to substitute my child's need for a hospital with something else. You need it, and you're going to get it. Now, the worst part is if you can't pay for it, and that's what you're talking about. How do we pay for it? Well, we're going to have to find a way, because the last and worst thing we can do is tell that doctor, that hospital, that medical clinic, you must provide the care. But guess what? We no longer will provide help in paying for it. So you're going to have to absorb that cost. It's bad for the patient, but it's worse for the people we depend on to provide the care. I'm not going to abandon the providers who are helping our sickest, our poorest, and those who don't have insurance. We're going to figure out a way. How are you going to do that? You just have no choice. That's what I had to do when the president said to me, save lives when we were in the midst of the COVID pandemic. I had to figure out how we got vaccines to people. Folks who were like us were getting vaccinated. But folks who weren't getting vaccinated were folks who were poor, who had 2 jobs, who didn't have transportation. How do we get them vaccinated? We didn't do things with business as usual. We went to them. I told my team, we're not waiting for them to come to us. We're going to them. And we did it. And by the way, 4 years in a row, I balanced my budget. By the way, a budget which is twice as big as the Department of Defense's budget, which, by the way, is 5 times bigger than the budget of the state of California.
But I want to just drill down on this. Is, as we figure this out, in order to maintain that level of coverage that you say is necessary, is more revenue on the table for you?
Yeah, everything should be on the table, whether it's revenue, and there will be cuts. Let me tell you, we have a high-class healthcare system that's very inefficient, that pays a lot of people who do nothing about actually giving you care. You talk to the physicians and the nurses today, and their salaries have gone up over the decades, but not as much as the administrators, not as much as the middlemen who do nothing about actually providing you with care. There is a lot of extra fat in the system, and right now, when times are tough, rather than try to make cuts to care, we can make cuts within the sector that don't do anything about helping a patient have better health outcomes.
You have been pretty critical of Governor Newsom's decision to roll back some health care coverage for people who are in the country illegally. The governor's office has said that the costs of that expansion were far higher than what they originally expected. Did the state get over its skis by expanding Medi-Cal to undocumented people?
The state may have gotten over its skis in the way it portrayed the expanded access, or the way it thought it would play out. But let's not be fooled. When people don't have access to care, it will not be cheap when they finally get to enter through the door. But what's worse and more expensive is if you never let them walk through the door, because then they don't use the door of that family care physician. They won't use the door of that community health clinic. They will use the side door of that emergency room, which is the most expensive way to do care. There's nothing more penny wise and pound foolish than to say that we've got budget problems, so we're going to cut health care for the folks who need it the most.
You have been in favor of single-payer healthcare system.
Yes.
On the state level.
Yes.
Governor Newsom ran on that when he ran for governor in 2018. That was his platform. Did he renege on that promise?
I think he tried hard, and we just talked about how he expanded care. The prize is giving everyone in California, and the way I say it is, anyone who works in California should be able to send their child to a doctor or the hospital. And if you work hard, you should not be without health care. That means we're going to hit that mark of universal coverage. Universal coverage is one of the main components of the single-payer system, but the single-payer system also tries to remove a lot of the middlemen. Single payer is difficult in California because we don't get to control how to get to single payer, because there's so many different laws and layers of the way the health system works to make it work. We don't control the ERISA laws, which control labor health plans provided through employers. We don't control Medicare because that's a federal program. We would need to incorporate Medicare, ERISA, employer plans, we'd have to get the federal government to buy in to do that. We'd also have to make many changes within the state. So I still believe, in fact, I defy anyone here to find a more efficient way to provide health care to your population than the single-payer system. But I'm also a realist. When I became secretary, one of the first things that President Biden essentially said to me is, Javier, you know I'm not a single-payer guy. I said, I understand that, but I do want to get more care to more people. And I said, that's the price. And by the time we left, as I said, more than 300 million Americans had their health coverage so they could send their child to that doctor or that hospital and not worry if they're going to be able to pay the mortgage or the rent.
I want to drill down on this because I know for a lot of voters out there that single payer is somewhat of a litmus test issue. And so you have sort of delineated the difference between universal coverage as a goal and single payer as a means to get there. But if a voter is trying to sort of decide what they're getting if they vote for you, are they getting somebody who is striving for reaching universal coverage or somebody who is promising a single payer system?
I am reaching towards universal coverage. I believe, let me say it again, I believe there's nothing that provides a more concentrated, focused, less expensive way to deliver health care than making sure that you as the payer, and in this case the taxpayer, have nobody between you and the provider of the health care, your doctor or the hospital, because your dollar goes from you to your medical practitioner. Right now, I guarantee you, your dollar goes from you to a lot of middlemen, insurance company, maybe a PBM, maybe someone who decides how you get your pharmaceutical benefits, before it ever gets to the provider. By the time the provider gets paid for what they're doing, a whole bunch of money's been taken out of the system. And so I still believe, and again, someone tell me a system that actually costs less. We pay twice as much in this country for healthcare than do most industrialized nations in the world. Many of them have something similar to a single-payer system. What we don't do well is try to make the best use of our dollars. And right now, when we have budget cuts, we need to make better use of our dollars. But eye on the prize, getting people access to their doctor or of the hospital, because it's not a choice. It's going to happen.
I want to go back to something you just said, which I thought was very interesting about if you work, you should be able to take your child to a doctor.
Yes.
That's been one of the biggest objections, I think, from Democrats on the Republican mega bill was the imposition of work requirements for Medicaid. And the Newsom administration estimates that 3 million Californians will lose their health care due to work requirements. But in sort of your framing of that, are you essentially endorsing work requirements?
Yeah, no. So let me make sure it's clear. I'm not saying if you don't work, you won't get health care. What I'm saying is there are people in California who work today and they can't get health care. And what I'm saying is if you work in this country, well, obviously in the state, with me as governor, you're going to have health care. If you don't work, we're still going to do what we do through Medicaid and through other programs. But I want no one in the state of California to believe that they're not going to be rewarded for their hard work by ensuring that they have access to the care that they or their family need, access to the college that their children will need, a roof under the head so that they don't become homeless. I want to reward work. And that's why I say, if you work, one of those essentials of life, healthcare, you're going to have. If you don't work, unlike Republicans who say, if you don't work, then you don't get Medicaid. No, I'm just saying, we're going to provide you the care. But what I want to do is let anyone who works in this state know, I hold you at a higher level because you are building my state, and I want to reward you. Essentially what I'm telling you is, I'm going to tell my mom and my dad, thank you very much for what you did for me.
I want to talk about, obviously your experience as health secretary. It's a high point in your resume. But there has been a lot of consternation among Democrats about the Biden administration and how transparent it was around President Biden. I've got to ask, were you upfront with the American people about the president that you were working for? Absolutely. And by the way, I believe the history books, maybe not this current administration, but the history books will write well about President Joe Biden. Because in 4 years, and I've been around working with or against every president since Bill Clinton. And there is no president, whether 8 years or 4 years, who achieved more
than Joe Biden did with the narrowest of majorities in the House and the Senate. And so for what he was able to accomplish, I give him just the biggest tip of the hat. And I was given the opportunity to be part of one of the major efforts there in trying to pull this country out of the COVID pandemic, try to help us get closer to universal coverage. For the first time, to negotiate the prices of the most expensive prescription medication in the country, down in some cases up to 80%. We had that opportunity. We put in staffing standards at nursing homes so that your parents that you put into that nursing home know that there will be a nurse working at that nursing home. And so we got to do some great things. And Joe Biden is the one that gave me those directives.
Do you think that the coverage has been unfair about his mental acuity?
Look, anytime you're in politics, you're going to face all sorts of fire. And I think even Joe Biden, the president, would say, I get it. You're fair to ask those questions. He was getting older. There's no doubt. And so everyone has the right to ask. But don't try to rewrite history. Joe Biden did some great stuff.
I can't believe that the clock is ticking down already, so this is going to be my last question. Your resume is extensive, as Stephen, when he was introducing you. There's a lot of formers in there, right? You were a former member of Congress, former Attorney General, former Health Secretary. And it does feel like we are in a moment right now where there is desire from Democrats nationally. We've seen for a fresh face, for newcomers. In this climate, how do you convince voters that your experience is an asset?
I'm just going to get out there. I'm getting to do, most people would not have said to that kid who was the son of immigrants, father who didn't get past the 6th grade, mother who didn't come to this country till she married my dad and came from Guadalajara, Jalisco, Mexico. First to have a chance to step into a university classroom. I don't think most people are looking at that guy and saying, hey, and they would call me Xavier sometimes, Xavier, and what do you think you're going to do in life? And my dad used to say to me, mijo, si me puedo levantar en la mañana y ir a trabajar, va a ser un buen día. My son, if I get up in the morning and go to work, it's going to be a good day. Because for him, if he didn't get to go to work, he might not have the money to pay for food on the table. And so for him, every day was important. You know, Pop, yo me puedo levantar cada día y va a ser un buen día. I can get up every morning, and it's going to be a good day. I can make it better for people like Manuel Becerra, Maria Teresa Becerra. There's nothing that I am missing in life. If I get to be governor, people like Manuel and Maria Teresa Becerra, a construction worker and a clerical worker, they're going to have some good days because I'm going to make sure that I reward their work and make sure that they can go to the hospital, they can send their kids to college, they can have the health insurance they need, they can have that home that they need above them, and they're going to retire in dignity. If I can't win, that's on you all. But I'm going to make an effort.
Well, Secretary, I know we're going to continue to have a lot of these discussions over the course of the governor's race. I so appreciate you being with us here today.
Thank you, Melanie. Thank you all very much.